Don't you hear this story? It's very interesting. The single A affiliate of the Texas Rangers, the general manager, Andy Milovich, has decided during the 7th inning stretch of the Myrtle Beach Pelicans' next home game that he is going to have a prostate exam done in front of a stadium full of fans. So this man, I guess, while singing Take Me Out to the Ball, he's going to be singing Take Me Out to the Ball game while having a prostate exam done. Joining me on 700 WLW is renowned urologist Alan Cordell of the Urology Group. Good morning, Alan. How are you?
Oh, good morning,
Renowned.
Scott. Hey, thank you. I appreciate that. Yeah, I've been around a few years, so people have heard of me. Anyway, it's good to have you filling in for Mike McConnell this morning. That's
yeah, right? No kidding.
That's very nice. Glad you can make it.
I always like my proctologist to have a sense of humor. That's always, although we've never had a business relationship. Oh, you may be my guy. I don't know. Let's start with this. What about, can you actually do that while singing at the same time? I think that's the biggest question, because being a man of middle age and having that done annually, not my favorite highlight of the year. I'm sure that's not the highlight of your day either, Dr. Cordell, but nonetheless, is it possible for a man to sing and have that type of introspection performed?
I think that is possible. And when I did Bill Cunningham and Bill Dennison on the air one Friday night a few years ago, Bill sang the whole time, but it was rather high-pitched. As a matter of fact, maybe Andy should sing the national anthem instead and get those high notes in there.
Oh, man, that will...
Now, this is very interesting. I don't know exactly how he's going to pull this off, but, women do breastfeeding in public, and it can be very discreet and very normal for breastfeeding a baby in public if everything's covered. And I think doing rectal exams, it kind of bothers me even looking at a guy having a rectal exam. So I don't know if they're actually going to have him on camera, which I don't think is comfortable for even myself, who does these every day about it.
No, I'd imagine it's going to be a highlight on ESPN because they're going to have a shot of his face while undergoing. You're going to know the let's say, how do I want to word this at 9:36 this morning, Doc? How about this? You'll know when the eagle has landed.
I think you're correct on that.
Yeah,
now,
we have touchdown. That's one small step for man. Yeah.
It's very good thing that he's doing, though. The prostate cancer, of course, hits 1 out of 6 men eventually. It doesn't kill that many, but it's a disease that can kill men, and if caught early, is very, very curable. And that's why we have prostate cancer awareness, and apparently they're doing a special there, and they're giving out foam fingers with the blue ribbons on them, which I think is pretty clever. I wear a little blue ribbon on my lapel every day. So prostate cancer awareness here in Cincinnati, we do this every year. In September, we have a 10K run at the Urology Center, and that's actually on September the 6th, a little promo there for the Urology group.
Good.
But actually, It's not for our group. It's for men and prostate cancer detection. So,
here's the thing, Dr. Alan Cordell, is that, women are pretty serious about breast exams and pap smears. They're diligent. They're serious business. You're a professional. You do this. You know the serious of it. But here we are, and most guys joke about the prostate exam. And because, I don't know why, I guess it's funny, because we find that kind of thing funny, kind of like when a man gets hit in the nuts. It's the same kind of level of humor.
Yeah, I'm laughing, but it's not funny.
It's funny. It's right. Stop laughing. Cancer is pretty serious stuff. But at the same time, do you think because of that the guys kind of dismiss it as stupid because of the humor found in it?
No one wants a finger stuck up their butt, and I can't tell you how many guys when I get ready to do the exam, they say, "Doctor, I don't like this part," and I say, "Patient, I don't like this part either, but it's something the two of us must do." And it's very, very important to do that exam, and it's very important to get the blood test called the PSA. And we can find cancer when it's very microscopic and almost 100% curable.
All right. When you put your finger there, Doc, what is it you're feeling for? What are you looking for?
About 1 inch into the rectum, you can actually feel the prostate, which is not in the rectum. It's adjacent to the rectum, just like you can put your hand on your neck and feel your tonsils if they're swollen.
Yeah.
You can feel the prostate. You can feel half of the prostate, the back half, but by nature of the disease, if it forms a hard knot, you can feel that knot anywhere in the prostate just by feeling the back of it.
Really? And that's the first indicator. Because I guess my question would be why, if we do blood screenings for PSA levels and your PSA levels are elevated, is that a better test than the invasive?
It's actually helps us to find cancer when it's even smaller than we can feel, but here's the problem. some people have a nodule in their prostate, which is cancer, and their PSA is still normal. So the PSA is not a perfect test. Neither is the digital exam. But the two of them together are going to pick up 90% of the cancer.
Can we live without a prostate as a guy? What does it do, and why do we need it?
Absolutely. Of course, women don't have a prostate. Men have a prostate. It's a gland just at the base of the bladder that produces part of the fluid that comes out with semen when you have an ejaculation. So it's part of the ejaculate. And after prostate surgery, you can still have erections, you can still have sex, but you have no fluid come out when you have an orgasm.
Why didn't we just...
Can we say that word on radio?
Yeah, well, you just did. What, Dr. Ellen Cordell, the Urology Group, what, if, again, if you're a younger guy and you're still in childbearing years, but, most of the time this hits guys over the age of 40, you're probably done having kids anyway. Why don't you just take the thing like a tonsil?
It's very, very rare in people 40 years old. Most commonly, they're 60 to 70 and a little bit older. The older guys, we just kind of keep an eye on them. We don't do anything unless it grows very rapidly. But younger guys, it's very dangerous because if you get it when you're young, there's a high potential of killing you, dying from prostate cancer.
Why do you just remove the prostate? Why isn't that like it's like a tonsil, right?
That would be like removing your neck and putting your head back on your shoulders. It's a big operation that causes a lot of side effects and complications, and that's something you don't want to go through unnecessarily, and most men are not going to have to go through it. As a matter of fact, today we have a new X-ray machine called the CyberKnife. It's not a knife. It's an X-ray machine that can kill prostate cancer in less than a week, and it's very effective for that.
Now, you did SEG's exam a few years ago. What was that experience like, for example?
Well, the studio was very nice. We had low lighting, and Bill was singing. Bill Cunningham was singing, not Bill Segman. He just screamed a little bit. No, I obviously with HIPAA, I'm not allowed to talk about patients.
Oh yeah, that's true. I was going to say, did you have to have like the Jaws of Life come in to separate the cheeks? I'm not quite sure what one would have to do there, but nonetheless,
I have very long, skinny fingers.
Yeah, well, you're a good man. Hey, you're like E.T. So, as far as getting the screening itself done, how come I go for a physical every year? Most guys, because of your health care, have to go. That's just kind of like a routine screen. Why?
Absolutely.
Do guys just say, "Hey, you're not doing that to me"?
Some do. Some say, no, I don't want a rectal exam. Occasionally the primary care physician doesn't want to do them, and that's not right. He should do a rectal exam once a year once you turn 50. And if there's a family history of prostate cancer, or if you're an African American, you need to start at age 40 with the rectal exam and the PSA blood test.
So age 50 is because I've heard mixed stories on when you're supposed to have it started. Now
that's exactly right.
I've heard 40. I had 50. Now here's a story for you. My first primary care doctor, who I promptly fired. I'm having a checkup. I'm about 35 years old, pretty good health. Everything's good. He's talking to me. He's like, I stand up, turn around. He's giving me the, feeling my neck and back. And he's talking about golf. And the next thing I know, I got attacked by the Empire of Japan, like December 7th, 1941. And I'm thinking, well, I honestly just got Pearl Harbored here. The surprise attack on my, what parts. I'm thinking, shouldn't the doctor let you know what's going to happen? I mean, 35, I thought I had another 5-10 years before that's going to happen. Why do physicians start at different ages?
I think it's a good idea to start early. It's just not something you have to do every single year when you're younger. But anytime there's any issues, any family history or any urinary issues, the prostate exam is very important to do that even early on. But mandatory rectal exams at age 50 should be started on all males.
Now, it's uncomfortable, but it's very brief, and of course, it's about it's not about you, it's about your family, your loved ones, and it's such a preventable type of all the cancers.
It takes less than 15 seconds to do a rectal exam, and it's not really painful. It's no more painful than having a bowel movement. It's even less so. All
right, Dr. Ellen Cordell of the Urology Group. Now, I just got a text here. Jim Kelch is listening, and Jim Kelch says, the Reds, he said, he is interested in maybe doing this during the Take Me Out to the Ball game in the next Reds homestand. Are you interested? Is your finger... But if you do it, he wants to have it done actually with the big foam finger, the Weir #1.
Oh, wow, that would be cool.
That'd be good. Would you be able to do that for Jim Kelch during the seventh inning stretch sometime in an upcoming game?
Absolutely. Give me a call.
All right, I'll hook you up there. Thanks again, Dr. Ellen Cordell. Appreciate it, buddy. There you go. How about that? What a good guy Jim Kelch is.